Welcome back to the Morning Blend. Ladies, listen up. March is Endometriosis Month. It's the perfect time to learn what signs and symptoms to look out for and when to see your doctor. And speaking of doctors, Dr. Urini Casada with WellHealth Women's Specialty Care is here to tell us so much more about endometriosis. Good morning to you. Thanks for coming back.
Good morning. Thank you so much for having me.
We talk about March being Endometriosis Awareness Month. When I say the word, it's like, oh, that's a fun word, but the symptoms that come along with it aren't so fun. Can you break down what endometriosis is?
Sure. So endometriosis is a condition in which some of the cells that are inside of the uterine cavity and some of the glands have been displaced outside of the uterus and now sit in your pelvis and some of your pelvic organs.
Okay. And how severe is this condition? Is it a disease? Is that what you call it?
Yeah, it is a disease, and the symptoms associated with it range from patient to patient. Some patients may have severe disease and may have mild symptoms, and some patients may have mild disease and may have severe symptoms.
Okay, and what are those symptoms?
Sure, so typically with endometriosis, the symptoms that patients may experience come in a form of pelvic pain. It's a chronic pelvic pain associated with their menstrual cycle, usually starts right before their menstrual cycle begins. It's also associated with lower back pain that's associated during their menstrual cycle, and also severe pain during intercourse.
Okay, so when one begins to feel those different symptoms, that's when they should go to the doctor? Is there something at home they can do first to test whether or not they have it?
Sure. So if you do have symptoms that are debilitating enough for you to take some time off of work, or you're spending time in bed the first couple of days of your cycle, then I think you should make an appointment with your practitioner, your clinician, just to kind of go over some of the signs and symptoms that you're experiencing.
Right.
At home therapy, usually treatment for endometriosis includes some anti-inflammatory medication, which you can buy over the counter. But again, if you're experiencing symptoms, I suggest you see a practitioner.
But is a little bit of inflammation during the menstrual cycle period normal? Because I think most women, I mean, I'm right there, we're both in that same category where we know what that is, we know what that pain feels like.
Correct.
And I believe every young girl out there feels that pain. Do we want them to say, oh, I might have endometriosis right away?
Correct, no. So it is normal to experience some inflammation, some discomfort on a monthly basis. However, it's the debilitating factor, you know, when you're taking time off of work, when you can't get out of bed, when you have severe symptoms, that's, you know, you're avoiding things like having intercourse because you know that it's going to be associated with severe pain, then that's when you probably should visit your practitioner.
The cause, when does this start? Is this something we are born with, or is this something that really triggers it? We had this sort of the same conversation earlier about candida, which is a toxin in our body, but for endometriosis.
So there are risk factors for endometriosis. If you have a first-degree relative, such as your mom or your sister, that has had a history of endometriosis, you do have a 7 to 10-fold increase of developing endometriosis.
Okay.
Also, patients that develop their menstrual cycle at an early age, less than the age of 11, or have shorter cycles, less than 27 days. Those that have heavy cycles and those that have prolonged cycles also are at risk.
Okay, and I believe we have a graphic we're going to pop up. Let's go ahead and, oh, you just showed it? Okay, well, there you go. They popped it up there. What is a day in the life of someone with endometriosis?
Unfortunately, it could be debilitating. You know, like I said, patients will call off of work. Patients will stay in bed. They dread that time of the month when it comes each month.
Okay. And when you go to your doctor, what are some of the questions you should ask?
You know, some of the questions that you should ask, first of all, when you go see your physician, we will do a detailed, you know, history and physical. And so if there are things in your history suggestive or in your physical exam suggestive of you know, having endometriosis, we will order further tests such as a transvaginal ultrasound because there are manifestations in your ovaries that could be suggestive of endometriosis. And then you can also discuss treatment options. You know, is this a time for us to start implementing treatment options? And again, that all depends on how debilitating this is for you.
And how does that, say a woman out there has endometriosis or finds out a little bit later in her mid-20s that she has endometriosis, how does this affect maybe carrying children, giving birth?
Very good question. So endometriosis has also been associated with infertility. And not every patient that has endometriosis develops infertility, but if a patient of reproductive age is trying to conceive and has been having difficulty with it, endometriosis could be responsible for their infertility.
And then obviously that's a whole different conversation as to where to
That's
go
correct.
from there. But there are ways to prevent it, correct?
There's not really ways to prevent endometriosis. There are things that can lower your risk for endometriosis. So there are some studies that suggest that if you work out more than 4 hours a week, you have a decreased risk. And also those patients that have high parity or have had multiple children and have had a long or lactate for a longer period of time have a decreased risk of developing endometriosis.
Okay, so it's something to just be aware of.
That is
Look
correct.
out for. This is Endometriosis
Yes.
Awareness Month. All right, there we go. Know the warning signs of endometriosis. WellHealth Women's Specialty Care has the professional staff and experience to help if you're at risk. For more information on their multiple locations around the valley, just head to the website or call the number listed right there on your screen. They are also on Facebook and Twitter. Still to come right here.